by having it confidential, people were more excited, and and when I'd see them, hey, you lost a pound or two. That's great. Nobody knew the numbers.
I see.
And they like that. And that's the same thing that Weight Watchers does too. So there's no, ooh, this person weighs such and such weight. Well, that doesn't work, because then you feel like you're being punished. This is all about positive. We're trying to do the positive thing. And one of the things that I offered, since the Health Resource Center has physician-approved books, including cookbooks, I offered as an incentive to the Biggest Loser, and we offered this was open to our satellite clinics also. We have a clinic in Gold Beach, Bandon, Myrtle Point, and Coquille. So each winner from those sites was able to choose a cookbook of their choice.
Nice.
Yeah, it was just something to keep the momentum going.
So then, John Smith, business owner of ABC Tools or whatever, says, okay, this sounds like a great idea. We need to lose weight. I want to build morale. He gets a scale in there. He designates a person to spearhead or direct the program, and they get a log book. And then how would you suggest they do each week? Would they bring in the Weight Watchers and then smoking cessation? How would you suggest
this
that?
was all on your honor. The Biggest Loser contest was all on your honor system. You just come in and whatever was going to work, with the exception of surgery. We did not allow any of the surgical procedures that are out there, such as lap band and bariatric surgery. Those people, because they've already got an edge on us. We wanted to emphasize physical exercise and healthy eating.
Okay.
Plus, we had everybody put in $10 at the very beginning, and so the Biggest Loser at the end got the big pot of money. So if you've got $200 out there, that's kind of a nice little incentive.
Right, absolutely. To go buy healthy food.
To go buy healthy food, you can go and.
That's great. Okay, so you talked about why it was important. That was one of my questions. Obviously, the health, the feeling better, and the community aspect of people coming in and saying, "I want to emulate. I want to do what you're doing."
Right.
It works for you. You're happy. You're smiling. You're feeling good about yourself. You're enjoying life.
Oh yeah.
And that's what we want to do. So let's talk a little bit about here. You gave me a worksheet that you developed, and it's very impressive, the work and the thought that Kelley's put into this. I'm just briefly going to mention some things, and then perhaps you can talk a little bit about them.
Sure.
She's also working with docs for the free quit smoking classes, and I believe that's on site. And
actually, unfortunately, at this time, it's not. That's still a work in progress.
Okay. Well, hopefully it'll be on site there, but I know there's other places in town that they can go to that you probably can refer them to.
Actually, yeah, it is recommended. It is currently over at the Bay Area Hospital Community Health Education Center, which is over at 39 Sherman, and they do it. It used to be just a one-time quit smoking, but I recently spoke with Linda Hicks, a certified diabetic educator at the hospital, and she's led the Bay Area Hospital she's been on the team for tobacco cessation over there. And she told me it's now an ongoing tobacco cessation plan. And so people can go to it. But for anybody that is on the Oregon Health Plan here in Coos County, which is also known as DOCS, if they would like to get the medication called Chantix, they must attend at least one session over there. And they will get a certificate, and then the Oregon Health Plan will pay for it, which I think is a really positive step.
Yes, it is a very positive step.
But our staff is encouraged to attend. It's open to, you don't have to be a member of just DOCS. Anybody who wants to quit smoking, that's an excellent resource.
And what date did you say that was going on at Bay Area Hospital?
It is, I don't have their dates. I believe it's the first and third Wednesday of each month.
But people could go ahead and just contact the hospital, and they'll give them the information of when these classes are.
Or if they want to stop by the Health Resource Center, I have what's called the Red Sheet. And I have a pad of the Red Sheet listed sitting next to the patient courtesy phone, and then of course all the physicians have them.
Okay. And the red sheet is?
It has the list of dates and the times.
Okay, great, fantastic.
And it's nice because it is offered during the lunch hour. So anybody who's got a lunch hour
Can go on up
can go on over there.
to North Bend Medical
No,
Center.
actually to the
the
check building.
check building.
They call Bay Area Hospital calls it the check building.
Okay.
I'm sorry, I'm so used to working with
Okay, that's the medical
medical lingo.
lingo that's talked around town here. Okay, so and that's located where?
At 3950 Sherman.
Sherman. On their lunch hour, they can go.
They
right.
can go on there, but they should make call to make sure that there's room in their classes.
I see. Okay. There's some other things going on. You had brown bag educational lunches. You've done a yoga lunchtime yoga program, or you're starting these. These are all things that are
works in progress.
Okay. And this just started off in January naturally,
Correct.
and you're still honing it. And
We're still honing
but
it.
it sounds very positive, and it's really results. I mean, and that's how you measure a successful program. The results. How are they measured? What's the evidence there to back that up? And from what you're telling me, you've got evidence.
I've got evidence. I am just seeing staff members, people that work at North Bend Medical Center. They're happier.
Yeah.
They look amazing. Because they look amazing because they're feeling good, and it's coming out. It just oozes out of their pores.
That's fantastic. That's so great.
And when you see your coworkers and when you're on lunch, any time of day, I take walks. I've got a coworker that I go walking with on a regular basis, and we either walk over to the hospital or there's a neighborhood behind North Bend Medical Center. And at any time of day, you can see people out walking. You can see staff members on their breaks or their lunches. I mean, you see a lot, especially on a nice day, even overcast days. Rainy days, you don't see so many people outside, but you do see them walking the stairs inside the clinic.
And people can come up and say to Kelley, "Hi Kelley, I saw you on Community Chess. I'm interested in the program. I'm partaking in the program, and I'm sure you would love to hear that.
Yes.
Their success stories.
Right.
Yes.
I would love to hear it. And if anybody ever wants any information, I'm happy to share. That's what the Health Resource Center is all about.
Now, the Health Resource Center is where exactly?
I am located on the main floor. When you walk in the main doors to North Bend Medical Center at 1900 Woodland Drive in Coos Bay, you walk in the main doors. I'm directly across from the elevators, but a lot of times people can find me just by smelling the coffee. We have a coffee bar there, which is really great. And that's what's helped make the Health Resource Center. I know it's a nice little bonus for the Health Resource Center because we've got nice chairs that people can come in and relax, learn. It makes it a non-threatening environment. So
it's actually like a separate area from the hospital.
Well, yeah, we're actually not a hospital. Hospital is separate.
I mean, not the hospital.
The medical center.
Clinic. Yeah.
Inside the clinic.
Yeah.
They serve really good beverages, and of course I myself love their coffee. But it makes it for more relaxed, because sometimes when you've been told, oh my gosh, you've got diabetes, you're scared, you're going, oh my gosh, what am I going to do? So and your doctor says, go down and see Kelley, or go down to the Health Resource Center. Kelley will get you this information. And it can be kind of scary, and some of them just want to sit there, and if there's the coffee or a cold beverage, and there's a vending machine, and they can sit and just relax.
Yes.
I make it my basis for modeling changing the Health Resource Center was how nice it is when I go to the Barnes & Nobles, to the bookstore, how you can go in, you can get your coffee and sit down and relax and enjoy a good book. That's what I wanted the Health Resource Center to be.
That atmosphere and
Correct.
Yes, just feels so non-threatening, like you said.
Non-threatening.
Yeah, that's very good.
They can relax.
So that's the Health Resource Center located at 1900
Woodland Drive.
Woodland Drive. I think I need my eyes checked again. And the phone number is
267-5151, and I'm at extension 1401.
And you also have an email address. These will all be put on the
Okay. And there's also a new email address that I've got for